Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce you now. Dr. Ana Claudia Rosa is a physician, radiologist, medical doctor at the VA healthcare system, and alumni and assistant professor or former assistant professor at the University of Minnesota. Dr. Rosa has done 2 radiology residencies, one in Brazil and one in the United States, where she obtained a doctorate degree and has completed a body imaging fellowship. Dr. Rosa has published in medical journals and has helped writing imaging books in Brazil with her 25 years of practice. Dr. Rosa loves to share her knowledge of visceral fat, the importance of its detection, and the description of the results to help guide her patients to achieve better health. Her intention is to bring awareness on how to detect a simple biomarker such as visceral fat on MRI scans, which makes it easier for patients to achieve results. Dr. Rosa works directly with Dr. Sean O'Mara, who we've hosted on episode 362 of Boundless Body Radio. Together, they focus on creating quality of care for education and interaction between patients and providers. Dr. Rosa's stories help others detect a silent killer that is visceral fat. You can find Dr. Rosa on Facebook at Ana Claudia Rosa, and on Instagram at Ana C. Rosa. Ana Claudia Rosa is the real way to say your name. Seja bem-vindo ao Boundless Body Radio.
Obrigada. Thank you so much.
Thank you so very much. Thank you for being on the show. It was actually harder for me to try to read your name, not the Portuguese way of saying things. So it would be Ana Claudia Rosa. It was harder to read it in English, but I wanted hopefully people to know your name and know the way we say it around here.
Yes, it's a pleasant coincidence that Chase knows how to speak Portuguese, as he was in Brazil for some portion of his life. And I am Brazilian, so it was really nice to get to meet him and be able to speak Portuguese and English with him about visceral fat and about health optimization. I am really grateful to be here. Thank you so much for inviting me and searching for me. And my intention here in the podcast is, like I've told you before, to bring awareness for providers who are ordering the scans, to bring some kind of guidance for the patients who I want them to become not like really patients, but active clients, advocating for their health and searching and asking for prior scans and looking at their scans themselves and discussing with their providers. And also for the people who have more power in dealing with insurance, so then they also could advocate for their employees, right? So I'm here to bring awareness, talking about visceral fat, my own journey as a person and my own journey as a professional. And I'm here to explain a little bit how imaging could be of help, a lot of help. And also for everybody to know that it's really important to have a good medical provider that advocates for your health, for optimization of your health, like Dr. Sean O'Mara, my friend. And also that radiologists are very important and very knowledgeable in visceral fat and everything else that is going to be in your scan. So although you're going to learn to see visceral fat, the radiologist is still super important and not replaceable, because there are other things that are very important happening in your body that the radiologists are of help, and that's why we exist, right? To be here to take care of you all. Yeah.
Well, we really appreciate that, and that's such an important thing to mention, is that we're not trying to, take away radiology or radiologists. It's how to make their job more effective. Just like so many other things in the medical industry, it's just something that is not taught. People don't know about it. It's not the provider's fault that they don't know these things, but that's why we're here, is to get that awareness out. And I'm so glad that you have started doing that. I came across your work when you did the podcast with Brian Sanders. We've also had him on the show, on the Peak Human podcast. And I was about 20 minutes into hearing the conversation. I was already trying to look you up and try to get you on our show as well, because I could just hear the passion in your voice. And I would expect nothing less from a Brazilian to have lots of passion about something. If it's not football, then something else. But yeah, it is an important topic that we don't know that much about. And you're right, your personal story does tie in with this quite a bit. So let's start there. What got you interested in, the medical industry and radiology in particular back when you were living in Brazil?
So I am, like Chase said, I am Brazilian, and I did my medical school in Brazil, and I graduated in 1994. and I started doing the radiology residency, and I finished it in 1998. And since then, I have been a radiologist for my whole life, since I'm 52. And I love being a radiologist, especially now that I'm more specialized. I came to the United States in 2008 when I got married, and I lived in Minnesota. My husband passed away in 2016, and I moved to Nebraska 2 years ago. And I'm here in Omaha now. And I love being a radiologist. I got my medical degree here at the United States through the USMLE and ECFMG, like all medical foreign doctors. And then I did the radiology residency at the University of Minnesota, and I consider the University of Minnesota my family. And then I started working at the VA in Minnesota when my husband was very sick. When he passed away in 2016, I went back to the University of Minnesota to do the body fellowship training. And I am so very grateful for all the things I have learned in Brazil and here in the United States. It is very important to understand that radiologists see visceral fat every day. We do see visceral fat every day. And in fact, when a patient does not have much visceral fat, the study becomes a little bit more challenging to read because everything is more crowded in your abdomen. So we kind of like visceral fat, quote unquote, because visceral fat makes things easier to see because it's just displacing everything and the organs are just floating in the ocean of visceral fat, like Sean says. I have never learned to describe visceral fat in medical school or during my 2 radiology residencies and during my body fellowship. And again, it's not because radiologists cannot see visceral fat or are not trained in reporting visceral fat. It's just because it is something that we as radiologists just go through it as if it's normal. You know, almost everybody has visceral fat now. When you don't see visceral fat, this study is harder to read. And that's sad. It's sad because we sit in conferences day in, day out that talk about Alzheimer, which is now quoted as diabetes mellitus type 3, that talk about diabetes, prediabetes, and talk about fatty liver, and fatty liver evolving to inflammation in your liver, and then cirrhosis, and then liver cancer. And we sit in conferences discussing liver cancer and all these amazing treatments that exist for liver cancer, but we don't step back. And that's why I'm here, because I want to bring awareness together with Sean and Omara and all the other doctors that are talking about health optimization. My goal is to bring awareness for all my radiologist colleagues that how about we step back? We start describing visceral fat in all the scans we are reading, since it has been proven that visceral fat is the root, is the cause of the majority of these things, right? So visceral fat leads to insulin resistance. Visceral fat leads to prediabetes, diabetes, fatty replacement of the pancreas. Visceral fat leads to, it has been proven, like fat around your heart and cardiac abnormalities in conduction. Visceral fat can be is studied to be a cause of mental disorders and dementia. Visceral fat, I'm citing everything in your body from head to toe. Visceral fat can give you like fatty liver again, inflammation in your liver, cirrhosis, liver cancer. Visceral fat has been linked to autoimmune diseases. Visceral fat has been linked to inflammation in your body that leads to cancer. So, and the patients who have visceral fat, if they are obese, they also are in the class of people that are more prone to have colonic diverticulosis or gallstones, and the fat in your pelvis makes your organs to be more relaxed. So then you're going to have something that it's called pelvic organ prolapse that is responsible for incontinence in women and prolapse of your pelvic organs, you know. And what else? Visceral fat also. Oh, when you have visceral fat and you have metabolic syndrome, then you start replacing your muscles with fat, which Sean calls so well the marbling of the muscles and the sarcopenia. And that's another thing that I want to bring awareness, is that it's very important to follow these strategies to optimize your health, because it is really not about getting old and being less fat or skinny or cute or whatever we used to think when we were 30 years old, or I used to think when I was 30 years old. Now I'm 52. My goal is I want to be 70 or 80 or even more, but I want to be functional. I want to have a functional body. There is ice here sometimes and I fall. What do I want from my body? I want my body to fall in a way that I'm going to get less hurt, or I want myself to be able to fall and stand up alone, and stand up when I go to the restroom. Like I saw my husband so many times not being able to stand up because he had sarcopenia due to the cancer, right? So that's the sarcopenia, that visceral fat and being sedentary and allowing your muscles to be replaced for fat. It happens. You don't have to have cancer to have that, right? And the MRI is such an important tool because it allows us to see the visceral fat. It allows us to see all the other stuff that I mentioned regarding the liver, the bowel, the pancreas. And that's why the radiologist is so important, and allows us to see also the muscle replacement by fat. And like Sean says, and I sincerely believe that the MRI is a better marker and a better way to evaluate for visceral fat than if you do a DEXA scan that gives you your body fat mass. It's because the DEXA scan is going to tell you, like my DEXA scan, oh, you have 44% of fat in your body. Yes, I do. I do have 44% of fat in my body, and that's horrible. And I'm working on that. But 44% is a super big number. But I have, it stays there in my brain and then boom, goes away, and I don't think about that very much. And then I remember that my bones are good. So it kind of, plays with your brain. But when you are with your MRI in front of you, like I was with my MRI, I even have chest tightness right now. When you have the MRI in front of you and you see that your abdomen is mainly filled with visceral fat, and that the visceral fat is surrounding all your organs. And then I was able to see how little of musculature I have in my abdomen, how the musculature that sustains my body along the vertebral bodies of my thoracic and my lumbar spine are already diminished and replaced by fat. Or I am able to see in my thighs the marbling, like Sean said, that looks like a steak that we're going to eat. And I am in the back of my mind thinking, I need my legs for me to walk. I don't really want to eat my legs, so I don't need them to be marbled. I need them to be muscle. And so yes, the MRI has this huge impact on engaging your vision, you really feel in your heart, you feel in your body, the senses connect. And like I said, just by talking about it, I feel this tightness in my chest because I know that I am way far from being healthy. But I also know that the visceral fat, despite of being metabolic active and despite of being the silent killer and this enemy that we are not describing, although we see it so well, I know that we can start describing it together, radiologists, and we can give some guidance to the providers, and the providers can start taking measurements, not the US measurements that say grains and fruits and veggies 3 times a day. No, the measurements that Sean O'Mara talks so well. And the good thing is it is reversible. It is reversible. You can build muscle. You can burn your visceral fat. And I love saying the word burn the visceral fat because it makes me feel empowered, powerful. And you can stop the inflammaging and just, rejuvenate yourself. because our body, thank God, has the ability to replace the cells on their cell cycles for each organ, right? So for the skin and for the liver and for the blood cells, we have a cycle in our body that replaces that. So when I start doing when you start doing the measurement, the strategies that reverse the visceral fat that we are able to see so well, that's a huge impact on renewing the cells with healthier cells, right? Healthier cells that will let you look younger, will let you look healthier, and more important, will definitely allow you to be functional in your body, for you, for your family, for the purpose you have to fulfill in your life, right? Yeah.
Wow. That is so well said. I love that. I love the part about burning fat as something that's very empowering. That's wonderful. I want to go back to what you were saying about radiologists seeing this every single day, right? So is it like the saying goes where the last thing a fish would notice would be water? Is it kind of similar to that, where since you're not taught it, it's almost like fascial tissue is kind of the same way. Like it hasn't even been in medical books until the last few years, even though it's there and you have to cut through it. It's almost like you're not taught what it is, and you're looking at the other things that you think are more important, and so you just miss it. Is that how it goes?
I don't think we miss it. I think we see it, and we only describe, like, we are trained in medical school and in the radiology residency, and I believe in other residencies too, we are trained to focus on the disease and how to treat and how to report in the better way. Like for the like a scan comes to me for me to read the scan, a CT chest or a CT abdomen or an MRI, and I am trained to describe for you the positives, right? Do you have cancer? Do you have inflammation? Do you have any finding that is important for you to follow up? But visceral fat got so ingrained that it's normal. Everybody has visceral fat, and I don't know why, to be honest, since we now know that visceral fat is the root, the cause of all these other things. But it's just like, if the visceral fat doesn't have a tumor growing on it, like a sarcoma or something, we're not going to describe it. We describe the sarcoma, we describe the liver, the fatty liver, we describe the fat in the pancreas. But like I was discussing with another radiologist, and he said, Anna, but if I'm going to describe visceral fat, I'm going to describe visceral fat in all my reports. And I said, yes, we are. And it's going to be overwhelming in the short term. And it's going to be overwhelming, again, backing up. Yes, we are, because unfortunately we are living in a pandemic of obesity, right? Like we had the COVID-19 pandemic, and to be honest, the obesity is worse than the COVID-19 pandemic because it's killing you slowly and for sure every day. And it's killing your loved ones and your family and friends. And we are not aware, we are not opening our eyes. And that's why I'm here, and Sean and you and everybody else, to bring the awareness, so then we can stop this and we can go back to being healthy. So yes, when I started describing, and I'm describing now for maybe 3 months, when I started describing visceral fat in my reports, it became like present in at least 95% of my scans. Why? Because unfortunately, people are like me. They have lots of visceral fat, and they still are eating processed foods. They still are not doing the strategies from Sham. I'm not anymore. I'm getting better. But like the majority, 95% at least of the people have visceral fat. And including the people who are what we call TOFI, which is thin outside and fat inside. People who believe that they are healthy and they are not healthy at all. They are metabolic unhealthy. They do have lots of visceral fat, which is a biomarker that needs attention because, again, like I said, it's metabolic active and it's going to create inflammation in your whole body. So again, going back, we have to describe, and it's going to be overwhelming because 95% of the people have that right now. But I believe that by describing it, we also are going to overwhelm the providers who are ordering the scans. But it's going to be, I hope, hopefully, it's going to be fast, short-term overwhelm. And then people are going to be start doing the preventative measurements, the health optimization strategies, and we are going to be advocating for health because that's what we were trained to be as doctors in our brain and in our hearts, right? We decided to be doctors because we wanted people to be healthy, do no harm. So I believe that when we start describing visceral fat and we start helping the providers on guiding their patients who will become clients on working and burning their visceral fat in a proper way, then we're going to have healthier people. And it's going to decrease the overwhelm and the burnout that the physicians are dealing nowadays that leads to a super high suicide rate between physicians. So it's going to decrease this overwhelm. And it's also improve the health of the people around us and the health of the world, right? So I guess it's really important that we see visceral fat, we have to start describing it, and together with the other things we see in the scans. And we don't know exactly, I can say for me at least, I don't know exactly because I haven't been trained for that, but I don't know exactly like when do I call mild, when do I call moderate, or when do I call severe visceral fat. But again, I am learning, and I am learning by observing. And that's how we learned in medical school, everything, right? And the most important thing is taking the step on describing and putting myself out there to help others in create health for them. So my reports nowadays, when I finish, I have a template that says metabolic. I just say metabolic, and it auto-populates, and that's usually how radiologists describe many things, because they have like templates that they save that make the work easier, and more like productive. So I say metabolic, and it says, and usually it's when I say mediastinal fat, visceral fat, fat around the heart, pancreas replaced by fat, fat in your liver. So when I say these things in the report, in the end I say constellation of findings are concerning for visceral fat. And then I put, this could be associated with a range of long-term metabolic complications and reversible, because it's really important to understand that this is reversible for the providers and for the patients who will get access to their report. And reversible with lifestyle strategies such as low-carb foods, no processed foods, high-intensity exercises, strength training, and some kind of sprinting activities. I change this sometimes for patients according to their age, or if it's a patient that is 80 years old or more. And unfortunately, I see that the patient has lots of comorbidities like an aneurysm of the aorta, an aneurysm of the thoracic aorta, or important vascular calcifications, or an enlarged heart. I kind of stop here in the strength training. I don't put the sprinting activities because I don't want, again, do no harm. You have, but also I believe that I know my limitations, and I know what I am able to do right now, and I can implement one strategy at a time. So then I will succeed, and I'm not going to harm myself, and I'm not going to fail, right? Yeah. Because patients with visceral fat also have lots of peripheral arterial disease, so severe vascular calcifications, problems in your heart, problems in your aorta, and some of them can't even walk very well because of the vascular insufficiencies, right? So each person is unique, Each patient is unique, and each treatment and each plan is tailored individually, right? We have to remember that.
Yeah, that is a really good template, though. Anybody could be benefited from choosing something off the list that you read and maybe focusing on that. And once you start to feel a little better, you can add another one and another one. And Dr. Amara is really careful when he talks about sprinting. He does promote sprinting. And I believe sprinting and sprinting like activities can be done for people of any ages. But yes, you have to be very careful because people just think, okay, I'm going to be Usain Bolt and run on a track and accelerate as quickly as possible. And Sean Amara is like, no, 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 no. Start very slow, work up to it. You can do high intensity things and it's fine, but there's a way to do it. So I really appreciate that approach. When we're talking about fat, there's a lot of confusion, right? Because we have dietary fat. Some of it's saturated that we hear about, or monounsaturated, and we hear about those terms. We don't understand really how fat works in the body, and we think fat makes us fat, and we don't even have a really good understanding of, well, if you know what's up, you understand how fat is delivered through the body, through the lymphatic system and all that stuff, through chylomicrons. But then you've got the fat that we have on the body, and we've talked about visceral fat. We've talked about in the past subcutaneous fat. We've talked about brown fat. There's all these different types of fats, and for a long time we just thought fat was inert. It didn't do anything. It just sat around. So maybe you could comment a little bit on the different kinds of fat and what it is about visceral fat that makes it so harmful. As I understand it, visceral fat or ectopic fat is really just found in the chest cavity and can be quite harmful, like you're describing. So could you maybe say a little bit about each type of fat and the visceral fat in particular and why it's so harmful?
So I am not an expert in fat, but I'm gonna say at least what I know a little bit, because as a radiologist, I really don't study all these things. And Sean is probably the best person to talk about it. So I'm gonna kind of use a little bit of the things I have heard from him, from other people I follow, and from his clients as well. So the subcutaneous fat is the fat that you have just beneath your skin, and it's a fat that, yes, more obese people will have more subcutaneous fat as well, but it's also a fat that is protective. And then you have the brown fat, which is more common in babies, but you can produce more brown fat. You can produce brown fat with all these strategies. And the brown fat is the fat that is important to warm your body, and it's more for that. Again, like I said, some people are going to laugh at me in your podcast because I'm really not a fat expert.
That sounded perfect. That sounded perfect to me.
And I am probably missing a lot of the important things to say here. And then you have the retroperitoneal fat, which is a fat that you have in your abdomen, and it's surrounding and it's adjacent to your pancreas, and it's adjacent to your vascular structures, the aorta, the inferior vena cava. And I know that there has been researches to prove that this fat is also beneficial. And then you have the visceral fat, which is the fat that you have in your abdomen that is surrounding all your organs. And if you do an MRI in a sequence that we call T2 sequence, when the fat is bright without being suppressed, that's the sequence that the clients and the patients usually like. That's the sequence that hits them on their face, because that's the one that shows like super bright white surrounding your liver and your pancreas and your spleen and everything else in your bowel loop. So this visceral fat has been proven to be metabolic active, and this is the visceral fat that leads to inflammation and is associated with all the things that I said before: the Alzheimer, mental disorders, diabetes, prediabetes, cancer, liver, fatty liver, and all the other things that I said earlier today with you. So that's the visceral fat that it's metabolic active. And the same kind, this is a metabolic fat. So it's visceral when it's in your abdomen, but there are other areas in your body that also have visceral fat, which is behind your eye. It's called the retrobulbar fat. And also here around your parotid gland area, you can have an increased amount of fat that it's also metabolic active, similar to the visceral fat. And then you have the fat that is replacing your muscles, right? All over your body. It's replacing your muscles in your upper extremities, your lower extremities. And also, I have been hearing from the doctors who work with that, visceral fat replacing the muscles of your tongue and the muscles of your neck, and being associated with loss of strength, and more like, I forgot the word, loss of strength. So it ends up giving you the obstructive sleep apnea, where the tongue falls back, and because it doesn't have good support, right? So this and then fat surrounding your heart and the vessels in your chest. So these are the areas that you could have the metabolic fat that is similar to the visceral fat that is metabolic bad and leads to inflammation and aging and cancer and death, right? And like I was saying before, and I stopped, the MRI is really awesome because for people who think that they are healthy and are metabolic unhealthy, which are the TOFI, thin outside, fat inside, the MRI is going to be able to show how much visceral fat you have, despite the fact that you might not have lots of subcutaneous fat and your BMI might be normal, but your BMI is normal, but you are not healthy inside, right? You have visceral fat, you have muscle marbling. And these are the people who are like TikTok, walking around believing they are healthy and they are not. And these are the young people like that, they are 40 or 40 something and they might be having a heart attack, right?
Yeah, so I really like this recommendation, and I will tell this to people. Like, if you have no other proxy, I think this is a really great thing to do, which is, generally speaking, again, not excluding the TOFI, but generally speaking, if you take a string and measure out your height and then measure your waist circumference, you'd really like that number to be less than or somewhere around half of whatever your height is would be your waist circumference. So that's nice, and it's pretty inexpensive to buy a piece of string.
Yes.
But like you said, you're missing things. Like when you do a DEXA scan, that's a more advanced way to look at things, but then you're only getting the number. I had not considered this until Dr. Omar really talked about it. It seems like what you're saying is it's more impactful if you can visually see. And just because you're not expressing obesity, that does not mean that you don't have some of this going on. Is that right?
Yes, it's correct. So there are 4 kinds of people. There are the people who are obese, and when they do an MRI, they have low visceral fat. They have lots of subcutaneous fat, but they have low visceral fat. And this might be like the people who play wrestling or sumo. I don't know, sumo
Yeah.
athlete.
Yeah. Like,
Yeah.
yep.
Yeah. So again, I excuse everybody, excuse my accent because I'm Brazilian. So there are the people who are obese and they have lots of subcutaneous fat, but they have little visceral fat. So they are obese and they are metabolic healthy. Doesn't mean you don't have to lose weight, because excess of weight is also damaging your bones, is also damaging your joints, and it's not healthy, but at least you are metabolic healthy, right? And then you have the normal people with the skinny people with, okay, go back. So the obese with little visceral fat, obese with lots of visceral fat, they are metabolic unhealthy. And then you have the thin outside, thin inside, which they are metabolic healthy and they are healthy in general. And then you have the thin outside, fat inside, which are the people that might be just like you, look normal weight and have good muscle bulk, but suddenly they do the MRI and they see that although they look that they are very healthy, they unfortunately are metabolic unhealthy. And yeah, so that's the importance of a cross-sectional study that could be a CT or could be an MRI. The advantage of the CT or the MRI, the advantage of the MRI is because it does not use ionizing radiation, so you can repeat it in 6 months or whenever you want after starting the strategies, so then you can see how you are becoming better. And also there is no need for intravenous contrast. So it's an MRI that you sit there, you lay down there in the machine, and you stay there for 20 minutes and you're done. And the CT could be used, but again, the CT uses ionizing radiation. If you, as a patient, as a person, by any chance have an old scan, an older scan that you have done recently within the within 6 months, that if you haven't changed much your lifestyle, if you have a scan, you can go to wherever you had your scan and you can ask for a copy of the scan in a CD, and you can look at the scan yourself and see if you have visceral fat. Again, you're not going to be replacing a radiologist, because the radiologist is important to read visceral fat and everything else. But visceral fat is something that it's simple to see, and it's gonna most likely, since 95% of the people have lots of visceral fat, it's gonna really impact you when you look at your own images, and you can discuss with your provider strategies that are really like helpful and proper, or you can just look online. You can check for Sean O'Mara, you can schedule with him, you can check for Peter Attia, you can check for, Anthony Chaffee, you can check for all these, Ken Berry, you can check for all these doctors that are really doing the health optimization protocols, which is mainly no processed foods and low carb or carnivore, and sprinting and high intensity exercises, and things that decrease your stress, like sunrise, sunset, exposure to sun, drinking water, drinking your electrolytes, walking, and not running, walking, practicing gratitude, and things that ground you to your soul, ground you to the world, and work for your well-being. Yes.
Fantastic. I know you are very, very, very good at English, by the way. And the way I can tell is you can say the word world, which is a really hard word to say if you're not from the United States. It's really challenging. You said it a few times. You've done great. I love it. Okay, so
hate that.
Thank you for giving us all of those tips and things that we can do. So I want to maybe go back a little bit with your own personal story. This was fairly recent for you discovering some of this stuff. I believe it was 2020 that you came in contact with Dr. Sean O'Mara. What was it like when you started working with him and he started, I don't know, like how did he start to present these ideas, and what did you think at the time, having practiced all of this stuff for so long, probably thinking you were doing some things healthily, right? Following advice or whatever. Like, what did you think of some of the things he was telling you? What was he saying, and what did you think of it?
So I have always had pride of my professional experience on thinking that I am a very good radiologist, and I work daily to be a good radiologist, because I kind of say that it's who I am. I am a radiologist, and when Sean came to me, it was in 2020, and he was just starting at the VA in Minnesota as a whole health director. And whole health is a program that it's for the VA, that it's focused like in improving health through different approaches, right? But he has been researching visceral fat, and he has research on visceral fat way before that. And you can check in on his website and in his bio, right? So he came to my office, so kind, so awesome, an amazing person, an amazing human being, light. And he came to my office and he said, Dr. Rosa, at that time he called me Dr. Rosa. Thank God now he calls me Anna. But he said, Dr. Rosa, I'm here because I wanted to do a program for the veterans, and I study visceral fat, and I wanted to discuss with you how could you start reading the scans and describing visceral fat. I looked at him as if I was like the dumbest radiologist in the world. And I told him, yes, I would be really happy to help you, but like, what does that mean to describe visceral fat? to describe visceral fat. I know I see visceral fat every day, but I haven't described visceral fat ever in my 25 years of being a radiologist. And he said, well, maybe we should just schedule a conference, a meeting, and you could come to my office and I will show you the scans that I have, and we can come together and make a plan for the veterans. So I went and he showed me lots of scans of his patients who had agreed to share the images. And I looked at the images and I was like amazed. And by realizing all the good things he was doing with an information that, as a radiologist who was proud to be really good on what I was doing, it was an information that was so vital and I was missing in describing it for him or for any other provider. So with time, we started working together with him, teaching me the visceral fat, how it impacts your body, and teaching me the 47 strategies he has to improve the body and optimize health, and showing me the improvement in his own clients, And then we kind of split apart. I left Minnesota and he left the VA, but we came together again. And I am really happy that I am being able to bring awareness as a radiologist, doing the work that he does, talking about the visceral fat, because I can see daily in the group that I am part of, that are his clients, I can see daily the improvement. I have seen scans of people who have multiple sclerosis and they are not really following the treatment, but they are getting better just by improving the visceral fat and improving the inflammation. Again, I'm not advocating to anybody to stop their medication, but I'm saying that you can reverse disease in your body by fighting visceral fat. You can reverse disease in your body by fighting visceral fat, and it's really very important to describe it as a radiologist to the providers. And it's really very important for the providers and the patients or clients to research, because they're so easy to find good people nowadays that are speaking the truth and they are teaching the proper way of fighting visceral fat. You can Google Sean O'Mara, and then from there, you are going to open your horizon and open your life to a complete different way of living and honoring your body, which he says so well. It's our major asset, right? My grandma used to say that it doesn't matter how much money you have if you don't have health, because you're not going to use your money and enjoy life if you are not healthy. So I would invite each one of you to spend your money according to your ability and according to your, the way you could. Not telling people to spend what they don't have, but I'm inviting everybody to spend your money in a monthly basis. Separate a certain amount of money to spend in improving your health, in making your body functional, because then you're going to be able to live better, use this money way less with medication or doctors or surgeries, and use this money for vacations and trips and good meat and a gym membership where you're doing strength training or equipment that will make you better and more functional and healthier. And on that note, I wanted to say that a patient once said in a podcast that I was with Caroline, I think it's Caroline. I say Caroline because of Brazil. Caroline Laboucher. Yeah, she's on Instagram. She has no visceral fat. She's a model, and that's amazing. She lives eating low carb fats, or low carb diet for forever, and she's amazing. She's such a kind soul and gives such good advice in her Instagram. And anyway, when I was talking to her, one of the people who were listening said, but MRI is so expensive. And I'm going to say a few things on this, a couple of things on this. MRI is very expensive, I agree. But there are certain, you can Google that too, and there are you can find a place where you could have an MRI of your abdomen that will be less expensive. And again, there is no need for intravenous contrast. And you can talk to your provider and get an order for any other thing. Maybe you have fatty liver, maybe you have prediabetes, maybe you have abdominal pain, maybe you have some inflammation already going on, most likely in your body because of the visceral fat. And then you could have an MRI that would seek for the cause of would seek for additional findings, right? So I would advocate for you to spend the money in your health and get an MRI. I would advocate for you to search for providers who do health optimization and follow Sean to see what he has to say and maybe become a patient of him as well, a client of him as well. And I would invite all the big corporations, Google, Facebook, LinkedIn, Instagram, I don't even know, Mastermind. I would invite all of you, Amazon, I would invite all of them to really start advocating for their employees and helping the patients on fighting for getting a visceral fat screening scan approved by insurance. So as a radiologist, I can tell you that we have screenings for liver cancer when the patients already have cirrhosis. We have screenings for lung cancer. We have screenings for prostate cancer, breast cancer, all kinds of stuff, right? So, or screening for exposure to toxins, that you have screenings for your lung as well. There is no worse toxin than visceral fat, which is inside your body. It is time, if not now, when, right? It is time for us to fight to get approval for a visceral fat screening, because visceral fat and fatty liver and non-alcoholic fatty liver could lead to cirrhosis and all other kinds of cancers that we're going to have being scanned forever and doing chemotherapy, which is way more expensive and so detrimental to the patient who is sick and the family. But anyway, if we can do screening for liver cancer in someone who already has cirrhosis, it is more than time to step backwards and start screening the visceral fat. So then we prevent the cirrhosis. So then we prevent the hepatocellular carcinoma, which is the liver cancer that is coming from the fat in the liver and the visceral fat as the reason, right? I'm not saying that some people are alcoholics and the heavy ethanol intake will lead to cirrhosis. So unfortunately, this is a different way. So it is important to have a screening for liver cancer, but it's also important to have a screening for visceral fat for us to prevent diseases that will develop from that and will just kill our loved ones so early, like it happened to my husband. And I told Chase earlier today, like my husband was diagnosed with stage 4 colon cancer at 49 years old in 2013. At that time, the screening age for colon cancer was 50 years old. So the people who were younger than 50 were not having a colonoscopy. And when they would go to the providers, they would be like, oh, most likely you have hemorrhoids or something, because colon cancer wouldn't even be in their, field of view because the person was younger than 50. So they were being diagnosed in worse stages like stage 3 or 4, and the 4 is not curable, although thank God there are many options of treatment right now that some people are living way longer. That was not my husband's luck, but I know people who were diagnosed with him stage 4, and I am so very grateful for them to be still alive right now. But at that time in Minnesota, the patients who were being diagnosed in a younger age, they got together with their providers, they got together with the American Colon Society, they got together with their Congress representatives, and they fought and they got approval for the colon cancer screening with colonoscopy to go from 50 to 45. So yes, it's not easy, but yes, it's so worthy to fight. We need to get together, and as patients and as doctors and as humans caring for each other, we have to fight for a visceral fat screening because, like I said, Alzheimer, diabetes, fatty liver, cirrhosis, you know, you name it. Everything has a link to visceral fat, and you can see it really well on MRI.
Oh, wow. Well, that was so much passion in that plea, and I would agree that we need to get these companies to change things. We would love to see the insurance companies change as well and include this in what they're offering. We did an entire episode about this back on, I want to say, episode 546, where we talked to Andy from Crowd Health, who started a type of a healthcare system that's crowdsourced. And part of what they do is as you pay your monthly fee, they negotiate directly with doctors and systems and whatever to do cash payments, and then people in the community basically come up with the cash, and everybody helps each other to pay for discounted rates. And it's something that I've been a part of for the last few months, and I love it. Health insurance for me is so expensive for something that I would never use. The point of all of that being is that doctors can take cash. They are probably willing to give you a discount if you pay them up front. And if you don't have the money to do something like this or to eat healthy, you better not have money to have an awesome TV and all the subscriptions to Hulu and Netflix and all this other stuff. You got to prioritize this kind of thing. So I love that you made that case.
Yes. It's like I have a family member who I was talking the other day and was also saying about like how expensive an MRI is, or how expensive it is to, do the strategies and start like looking for healthier foods and all this kind of stuff. And I say, well, you have to choose how you want to spend your money, right? Do you want to spend your money enjoying your life in a functional body, or do you want to spend your money with an oxygen gas tank and in a wheelchair, not being able to even go to the bathroom alone, right? And one of Sean's clients says, you have to be tough to be healthy. So you have to be tough to do the strategies. You have to be tough to fight and find a provider that will advocate with you and walk the journey with you. You have to be tough to just say yes to your life every day, to say yes to your body, your major asset, your only asset. We only have ourselves, right? So we have to be tough to take care of us. And I tell myself, today I'm choosing the hard because tomorrow I want to age more comfortably. I'm choosing my hard today. So tomorrow I'm going to age with more comfort, And I want to invite my colleagues, my radiologist colleagues, to come together with me and start describing visceral fat, even if it's like I'm doing in a simple way, mild, moderate, severe, to start giving some guidance to providers that are ordering the studies, like I said, saying that this is linked to metabolic issues and it could be reversible with strategies, because that's working towards health. And physicians who order studies nowadays, more than ever, they rely so much in radiology, telling them what's going on and telling them what to do next. So I would invite my radiology colleagues to come together with me and slowly but surely, one step at a time, one report at a time, start making a difference and start making a change together, not one against each other, but together. I'm not here to point fingers at any radiologist. I'm here to invite us to describe something that we already see and we know better because we are trained and we know how to see it, and help providers like we do every day when we say follow up in 3 months or do a biopsy, so we can help other providers that will be willing and open to us. And I would invite the providers to research about visceral fat and to research about the strategies, so then you can help and apply that in your own patients. It's simple. I know, like, Sean has a video that it's 2 hours. If you watch that 2 hour video from Sean, you are already going to get all the information that you might need to start the journey of optimizing the health of your patients. So I know it's very overwhelming, and we are dealing with burnt out so much in the medical system, in the medical field. But like, I would invite you to look for Sean as a provider. I would invite you to listen to his 2 hour talk, or to any other talk that he says he's that is available from him. And I promise you, it's going to be life-changing for you as well. It's going to, because the majority of the doctors are not healthy because we are sedentary and we work long hours and we are so tired and we are so exhausted that the only thing we do is work and eat and sleep. So I would invite you to listen to Sean for you, for your health, for your family, for your loved ones, for your grandkids, and then start optimizing the health of your patients. It's not 3 meals a day. It's not grains. It's not processed foods. It's not medication. It's like eating healthy, eating low carb, eating carnivore, eating ferments, sprinting, strength training, high intensity exercises, cold showers, and yes, it's sauna and sunrise and sunset. It's nothing that you're going to spend much money. It's nothing that you cannot implement one thing at a time. And I am a Jay Shetty health certified coach, so I've learned the SMART, right? Simple, small, measurable. So do one thing today, do it for a month, and then add another thing and do it for another month, and then add another. I'm not telling you to do everything today. You're going to fail. So be compassionate to you. I tell myself compassion, consistency, and commitment, right? Commitment to my health, my body, my mental health, because it will improve your energy. And I'm talking too much.
Not at all. That was absolutely beautiful. Just so beautiful. What an amazing invitation for everybody out there. And I just really hope it reaches a ton of people. Your work is amazing. I'm so grateful that you have found this and that you've been able to continue to transform your life and help other people to transform theirs, because it's a very important message. And it's really wonderful. It was so awesome to host you, Dr. Rosa. Where would you like people to go to find you and connect with you and your work?
So I work for the VA, so people are not really gonna be, I'm really not gonna be of help to any client that it's outside of the VA. But like, people could find me on my Facebook, people could find me on Instagram, people and I would say connect Sean for his strategies and follow his work, because he's the doctor. He's the one who is going to give you the guidance. I am the radiologist. I am in the background. I am in my room behind my computer, just telling you if you have visceral fat or not, telling Sean and the other things that come together with the scans. Like, I'm not looking only visceral fat, right? I'm not, yeah. But yes, if I could be of any help, just find me on Facebook or Instagram. But I am mainly as a radiologist a help for your provider. I am the backup of your provider. I get the back of your provider, and your provider gets your back, right? I am the doctor for the doctor, and your doctor is your doctor. So yeah. And I'm gonna look here at my papers, so then I see if I told you everything that I planned for that, because I just want this podcast to be really productive and bring awareness and bring clarity and bring a coalition and make people work together and make people work for each other. And that's what I want to say. We need to create a metabolic health care group. where we're going to have the ordering providers, we're going to have psychologists helping with mental health, we are going to have dietitians helping with the low carb, no processed food plans, and personal trainers. And just again, invest in yourself. You are your major and only asset. Choose your hard, be tough to be healthy, work in being functional. I heard the other day a podcast, the person saying that when you don't take care of yourself and you just keep living life on your own ways, you are being selfish, because in the end you might need a caregiver and you're going to be a burden to whoever is going to be your caregiver. So, and that is, someone who lives with you might be doing the same thing. So I would invite you to not be selfish, to love yourself and love your neighbor, right? And yeah, take good care of yourself, because then you're going to be taking good care of your relationships now and in the future. Yeah, because
Love
you want
that.
to be able to take care of yourself.
I
Yeah.
love that.
Yes.
Well, thank you so very much. It's such a wonderful message. Thank you, Dr. Rosa, for taking the time to come on our show today. We just really, really appreciate you and your amazing work.
Thank you so much, Casey. I am honored to have met you, and I am honored to have you in my journey. And now in Portuguese, obrigada.
Ciao, ciao. It has been an honor to host you as well. And yes, we'll be practicing Portuguese quite a bit in the future. This was wonderful. But thank you for taking the time to be on our show today. We really appreciate you.
Thank you. Ciao.
And this has been another episode of Boundless Body Radio.